The main mission of the Heart Rhythm program at Southlake Regional Health Center is to provide world-class heart rhythm care close to home for our patients in York Region, Simcoe Region, and Muskoka regions.
Traditionally in Canada, all the electrophysiology services were centered in the downtown teaching hospitals. And in terms of decentralizing care, once Southlake decided that they were going to become a regional cardiac center, it was our opinion that you could not be a full-service cardiac program without having electrophysiology services. So it was our intent to start an electrophysiology program in the community outside of a standard university teaching center to bring services to the region. Previously, our patients used to have to travel long distances all the way to downtown Toronto to receive these services, which is inconvenient and not the best patient care. So for us to be able to provide world-class, cutting-edge procedures close to home was a big change for the Canadian environment. And for our patients' purposes of not being able to access the technologies and the treatments available, we thought it was most appropriate to bring it to the community rather than bring the community to the service.
Southlake Hospital has been for quite a few years already a model of innovation and good care. I joined to Southlake program a few years ago, and my first shock was I was impressed how much I can produce. So I walk into a procedure room and I was able to do 2 or 3 times more work that I used to do on my own. And then I realized, well, the team helps working with very high-skilled nurses and technicians, and with the state-of-the-art technology, things really make me fly through. And that really made an amazing experience for my career.
We implant defibrillators and pacemakers, as well as cardiac resynchronization devices. We do approximately 1,500 of these devices, all encompassing per year. The home monitoring program pioneered here at Southlake is an amazing program by which our patients are able to have monitoring at home without having to commute to Southlake. Patients live very far away at times, sometimes 2 to 3 hours commute to have their devices checked otherwise.
We recently developed 3 new state-of-the-art cardiac electrophysiology labs which are capable of accommodating both implants as well as ablations, and these labs are stocked with absolutely state-of-the-art technologies.
Since starting at Southlake 15 years ago, we have been lucky to be at the forefront of development in electrophysiology. We were the first center worldwide to use cartosound, integrative ultrasound in men. We also were one of the first centers to work with new technologies such as the Genesis mesh balloon for ablation of atrial fibrillation, as well as the PVAC catheters were one of the first centers to use in North America. We always look to innovate, we always look to improve on the success and efficiency of the procedures that we perform. We want to improve patient experience, make sure that we achieve long-lasting success in ablation of atrial fibrillation and other arrhythmias such as ventricular tachycardia, and etc. And make sure that we do a good job looking after our patients in our region and in Ontario.
As our program grew in terms of numbers of procedures, and as we had access to newer technologies, we started to develop our own homegrown research, mostly of clinical trials and other clinical projects which have generated a lot of significant peer-reviewed publications. Our STAR-AF2 trial, for example, was published in the New England Journal of Medicine, and our ongoing OCEAN trial will finally answer whether AF ablation can reduce the risk of stroke. We are very proud to be part of the Southlake Regional Health Center Heart Rhythm program. We are proud of our accomplishments, but we're also very excited about what we're going to do in the future for the care of our patients.